Okay, so let's discuss the temporomandibular joint. Okay. The temporomandibular joint, okay, if we can just start writing, I'll go slowly and we can see how we can dissect the parts of it and type, movement, everything, okay? So first, the temporomandibular joint is formed by the articulation of the mandible and the temporal bone of the cranium. Again, the temporomandibular joint is formed by the articulation of the mandible and the temporal bone of the cranium. Where is it located? So location of the temporomandibular joint, and of course here.
I'm sorry.
Yeah.
I'm sorry. Mandible
Yes.
and temporal
Bone of the cranium. So the mandible and the temporal bone of the cranium.
Thank you.
No problem. And so now they will ask us, where is it located? Let's say, if he asks you where is it located, you will say, it is located anteriorly to the tragus of the ear. Anteriorly to the tragus of the ear. Tragus is a part of the ear, okay? Tragus of the ear on the lateral aspect of the face. Anterior to the tragus of the ear and lateral aspect of the face. Okay? So now we're going to look over the articulating surfaces, ligaments, and correlations, okay? So the articulating surface. So when he asks you what is the articulating surfaces of the temporomandibular joint, we say the articulations happen between three surfaces. The articulations happen between three surfaces. And here on my screen, you see the first surface is the mandibular fossa. The mandibular fossa, okay? Mandibular fossa. The articular tubercle of the temporal bone, mandibular fossa and the articular tubercle of the temporal bone. And the last surface is the head of mandible. The head of mandible. Okay, three surfaces, mandibular fossa, articular tubercle of the temporal bone. Both of those things are in the temporal bone. And finally, you have the mandibular head of the mandible, okay? So what's unique about this joint?
Sorry.
Yes.
Articular tubercle of temporal bone?
Yes, exactly.
Okay.
And the mandibular fossa also of the temporal bone, okay? And finally, the mandibular head. Fine. So what is unique about this joint is that those bones don't touch. What's another joint that you remember where bones don't touch? For example, the ulna and the proximal.
Yeah, I wanted to mention.
Exactly. Same sense. Here we have an articular disc. So the bone that Nasti was going to mention is the ulna articulation with the proximal row of the carpal bones, because both of them are convex. So there's an articular disc there. Same, and likewise here we have an articular disc. Okay. Okay. And the
I'm sorry, can I clarify? Because like mandibular fossa, it is it is good for articulating with mandibular head, because mandibular fossa, I think it has with con no
Yes,
concave and
concave.
mandibular
Uh,
head has convex, so
yes.
it can articulate. Why does articular disc located between mandibular fossa and mandibular head?
I think there's no reason to mention here, but like I think because if you look at the mandible really, if you look at the mandible, it needs support, and the only support it's having to the head is that. And I think the articular disc is present there to avoid injuries in a way, you know? Because what's the point of their discs? They're just there to prevent friction of bones, just like the vertebra. Why is there articular discs in the vertebra? We know that the articular discs in the vertebra can help bear weight. For example, but here is different. But it's just the presence of articular discs vary in different places. But I would say here maybe protection is the key function. In the vertebral disc, talking about articular cartilage in the or the articular disc in the vertebral column, if you're standing, I don't know if you ever felt this, if you're standing for a whole day, like carrying a bag, okay? And then you come home, you put the bag down, and you lie on bed, and you feel like your the pain is relieved. Why? At this stage, when you're on bed, now your vertebral discs are decompressing, and that relief from pain is because the vertebra is actually decompressing and extending, because the whole day it was compressed. So when you lie on bed, it decompresses. But that's for the vertebra. But here, I think just protection. We can search that actually. That's very
Okay, thank you. I got it.
One second. Yes, exactly. Stress absorber. That's why it's there. So basically, as I said, your jaw, um, like if you check what how your jaw is held to your head, basically just that, with some attachments to muscles in the neck and stuff. But the temporomandibular joint is there to help with the jaw activity, because you know you're chewing, you might when you're sleeping and stuff, you're moving, you're always talking, and this jaw has to be lenient. That articular disc avoids stress, it absorbs stress and distributes it. You know what I mean?
Yeah. So I wanted to note it just in case. So articular articular disc function is um
Absorbs stress and distributes it. That's the function. It absorbs stress and distributes it. Okay.
thank you so much.
No problem. Okay. Next, articular surface is clear.
Yes.
Okay, ligaments now. We have 3 ligaments. And they're extracapsular. What does that mean? It's like externally in a way. Okay, it's not in the joint itself, but externally. And they act to stabilize the temporomandibular joint. There are 3 ligaments. Number 1, and maybe I can take a picture of it. Wait, and share it with you guys. Ligaments, so that it's clear while I explain. Yeah, maybe here. There we go. Just give me a second. Lateral ligaments. Here. I found the picture. Let's see. Okay, do you see it?
Yes.
So now, first one is the lateral ligament. Lateral ligament. First one is the lateral ligament. Lateral ligament. So the lateral ligament, and we have to know always, and we have to tell him where does the ligament run from? What it connects what to what, okay? Lateral ligament runs from the beginning of the articular tubercle to the mandibular neck. Okay, runs from the articular tubercle to the mandibular neck. Okay. It is thickening of the joint capsule. It is a thickening of the joint capsule. Wait. Ligaments.
What does it mean, thickening of joint capsule?
So the joint capsule is this, okay? Do you see my mouse?
Mm-hmm.
And the lateral ligament is from here to here. So basically it thickens it. See what I mean?
Mm-hmm.
Okay.
Yeah.
It is thickening of the joint capsule and acts to prevent posterior dislocation of the joint. Acts to prevent posterior dislocation. So for example, if you are pushing the mandible this way, let's say someone like punched your jaw and your jaw is pushed this way, the lateral one here prevents it from going back. You know what I mean?
Mm-hmm.
That's the function. Second one, sphenomandibular ligament. Sphenomandibular ligament. Sphenomandibular ligament. The sphenomandibular ligament originates from the sphenoid spine. And attaches to the mandible. Originates
From sphenoid spine, yeah?
from sphenoid spine and attaches to the mandible. And you can see here, that's the sphenoid spine right here. And it goes down to attach to the mandible, okay?
Mm-hmm.
The final one is the stylomandibular ligament. Stylomandibular ligament. Stylomandibular ligament. Stylomandibular ligament. It runs from the styloid to the angle of mandible. Runs from the styloid process to the angle of mandible. And the function, before the function, it runs from the styloid process to the angle of mandible. The function is to support the weight of the jaw. Supports the weight of the jaw. Okay. These are extracapsular ligaments outside the capsule. And we know that the joint itself has a joint capsule around it. So you have a joint, right? Which is the head of mandible joining with the mandibular fossa and the tubercle of the temporal bone. This is the articulation surfaces, and there's an articular disc. And this joint, all what I said, is surrounded by a joint capsule, okay? And the joint capsule is the capsule, okay? And it has nothing within it except itself. It's some sort of a covering for the joint. And that's why these ones are extracapsular, to notify you that there's a capsule and these ligaments are outside the capsule, okay? Deal. And these four things you have to know about it. So we know the bones involved, we know the articular surfaces, we know the ligaments now, okay? Now we're going to speak about movements. Okay. movements. The movements, you have 1 second, 2 types. Yes. Okay. Protrusion and retraction. That's the first one. The upper part of the joint allows protrusion and extraction of the mandible. And retraction, sorry. So anterior and posterior movements of the jaw. Okay.
What does it mean, protrusion and retraction?
Which is movements anteriorly, posteriorly.
Mm-hmm.
Okay. Elevation.
So
Tell me.
a retraction is when our lower teeth are covering our upper teeth. It's
So
retraction.
imagine, okay, you know your incisors, the front teeth.
Mm-hmm.
If the lower incisors are in front, like if you push it in front, and you see the lower become more anteriorly than the upper, that's what protrusion.
It's protrusion, right?
Yes, and if they're behind the upper ones, then they are it is a retraction of the mandible.
Okay.
Okay. And the other type of movement that can happen, elevation, depression. Elevation and depression. So basically, depression is towards gravity, elevation is away from gravity. And then you have lateral movements, right and left. Lateral movements, right and left. Okay, just give me a second. Right and left.
Yeah, I remember this class when Siritsky even like shows us how it works. Like he was like moving his mandible.
Yes.
And just like, see, look guys, this is protrusion, retraction,
Exactly.
lateral movements. Yeah, he was like, okay.
So I miss this guy, man. Oh man, we used to laugh so much in his lectures, but we'd laugh at ourselves, honestly. Okay. Yes, and then wait, just give me a second. Maybe I can. Or wait. There. Okay. Yes, depression, elevation, protraction, retraction, and lateral movements. What else should we mention? Just give me a second. Yes, of course. The joint, in order to describe like mastication, like the joint also helps so much in mastication, because these types of movements, all of what we're saying right now, help the mastication muscles surrounding the mandible to help us chew. Okay, and that's why this joint is very important. These movements are so important. And when you take the muscles of the mastication, you will see that this joint is just a form in which it allows for so many movements so that we can chew food, you know? Okay. maybe one more thing, I don't know. Let's see if I can find some more things that we should know. Yes, I think this is good. Okay, and I think the temporomandibular joint is a condylar joint. Okay, it's a condylar. The type is condylar. Okay.
Mhm.
Okay. It's very sophisticated, but I think one question you have to put a question mark on there. I need you to just know what Serisky wants you to describe this joint. I actually forgot. Sometimes he's annoying. Like you can be studying from many resources and then he comes and tells you the book is wrong. So just make sure. Like I don't know if you guys know, did they mention what type of joint is the TMJ? What does he want? Because
Actually, from his like now I'm looking at his like screenshots from his online lecture,
Yeah.
and I see like in the topic of joints, immovable joints, there are sutures, syndesmosis, and gomphosis.
Yes, sutures, gosmosis, and composite. Exactly, these are the skull joints, plus the temporomandibular. This one is
Oh,
it's
here
yes.
I found like type of sutures,
Mhm.
and like for example like squamous, serrate, and stuff like that. We need to mention from the weakest to the strongest, I guess.
I
Then
see. You know what the weakest are? Because I think he mentioned something such as the pterygon or pterygoid. Wait, let me just remember this.
it's like a
The
plain suture
Mhm.
or median palatine suture, like with the example. Then we have squamous,
Mhm.
serrate, I guess, denticulates, and shindilesis.
Can you maybe share these notes with me or something? Because
Yeah.
like it's very important actually. Because I can't find the point here. But did we get the temporomandibular joint? Is good?
Yeah.
Okay. This joint is his favorite, I'm telling you. Please memorize it. Okay? Okay. And then we have, so that's one joint of a skull. Okay. Sutures, simple sutures, beveled sutures, lambdoid. Okay. Okay. All right. Maybe it's good to test you on this joint. So I want you guys to memorize it, and we will reopen the meeting, and you will narrate to me the temporomandibular joint. It's very important, and maybe if we have time, we can do the sutures and everything. If not, we can continue them where we stop. Okay.
Okay.
Yeah.
Okay. I will let you guys memorize this one, and then we can come back. Okay.
Okay. Now I'm sending
Yeah.
these slides from his lecture.
I really want to see what he's doing. Okay. Thank you very much. I will see you in a bit.
Okay. Thanks.